Hello. Today we will continue our discussions centered around the coronavirus pandemic. Our goal is to bring useful and interesting information as it relates to this crisis. My first guest is Allison Egan, a specialist in disaster response. My second guest is Captain Elliot Higgins of the Pittsfield Salvation Army, who will share some impressive statistics with us. Let's start with Allison. Allison, thank you for joining us. Allison, can you tell us a little bit about what it is you do?
Yeah, so I am an employee of the Berkshire Regional Planning Commission. I'm a senior public health planner, but my primary focus and specialty is in disaster response and preparedness planning. So I work with the Berkshire County Boards of Health Association and the Berkshire Public Health Alliance on preparedness activities.
And that encompasses all of Berkshire County then?
Yeah, so the Berkshire County Boards of Health Association, which is housed under the Planning Commission, provides services and guidance and kind of a governing structure to the 32 boards of health and health departments in Berkshire County. So every municipality is included in that association. And the Berkshire Public Health Alliance is an association of about half of the towns in Berkshire County, where they provide public health nursing services and inspectional services and other more traditional public health day-to-day operation services.
I understand. And how does that relate to this current COVID-19 crisis? What is being done through your organization to help with whoever needs the help or whoever you have authority to help?
Yeah, so the Berkshire County Boards of Health Association is the county's public health preparedness coalition officially. That's through funding from the CDC. So every year, it's kind of a fund that I'm primarily funded under. It's the Public Health Emergency Preparedness Funds administered through the CDC. We work with the boards every year, especially the health departments every year, to do regular preparedness planning, to loop them into kind of current issues in public health disasters, emergency dispensing site planning, pandemic flu planning, flu clinics and things like that. But the way that will relate or has related to the COVID-19 crisis is that we've all been working together essentially just in a planning phase for years and years. BCBOHA was incredibly active during the H1N1 response in 2009, and then also pretty active through other disasters that didn't end up as big here as they could have, but things like Zika and Ebola responses, BCBOHA was also very active in them. But definitely from the early days of COVID-19, BCBOHA put together not only their executive committee, but a working group of all of the staff that work for boards of health and health agents and directors from around the county to organize together from day one when we knew, maybe this won't be as big of an issue as it was in China, but it could be, so let's organize now. And I'm grateful we started that structure on day one, basically, so that we're where we are right now. There's tons and tons of guidance coming out from the governor's office relating to a lot of things that boards of health have authority over or are required to provide some service for. So, for example, the closing of restaurants for sit-down service, new guidelines for food establishments and grocery stores, for example, and kind of enforcement of like social distancing and things like that. That's something that the boards of health are responsible for. So the Berkshire County Boards of Health has been really well poised, I think, to kind of translate that guidance and provide some technical assistance to the boards of health, especially the ones that are less staffed or very operate on volunteer staffing. Basically, we've been able to provide technical assistance that they might not have had access to if they were outside of a regional structure. But I do have to lend it to the boards of health who, whether they're a health department with paid staff or volunteer staff, the boards of health have really stepped it up, and they've gone from having, 50 responsibilities to having 150 responsibilities, and new guidance coming at them every day, and have basically had to become experts in a disease that there's no experts in order to keep the public safe. And so it's certainly a partnership. We have paid staff that can provide guidance and documentation for things that they request, but in terms of their municipality and the enforcement, they are the chiefs basically in that regard for public health.
Are there specific groups that you work with in each municipality, such as the police department or first responders or even hospitals?
Yeah, absolutely. So the boards of health are our main organization that we work with in each municipality, but in my professional capacity in disaster planning, I work often with police departments, fire departments, emergency management directors. I work with EMS services. The local hospitals are huge, excellent, important partners in our operations. And also, I do want to call out the regional emergency planning committees, which are REPCs. Those are associations that exist in the northern, central, and southern parts of the county. And they are an organized structure of all disciplines in every municipality, but it's focused on emergency planning. So you have Northern Berkshire REPC, Central Berkshire REPC, and the Southern Berkshire REPCs that include public health. They include all the first responders that we work with, the hospitals, social service agencies and businesses, and also municipal officials like select board members and town managers and things like that. So that's a structure that we work with often, but on a day-to-day basis, I'm working with, anything from public health people to the Department of Public Health at the state level, the CDC, and then local police departments.
Do you get involved at all in procuring personal protective equipment?
It depends on, so for the coronavirus so far, there's 3 command centers basically operating in Berkshire County. So it's the Northern Berkshire REPC. They've opened up their command center. The Southern Berkshire REPC is also operating in that capacity. And then there's the Central Berkshire COVID-19 coordinating center, basically. They have a long acronym and I'm trying to remember it in my brain. But they are also operating in a resource request and supply capacity. So while on a day-to-day basis, outside of a pandemic, our public health, the Public Health Alliance or BCBOHA might be able to distribute some flu supplies, some gloves and masks that we would typically use. Definitely the coordinating centers and command centers through the REPCs and the emergency response folks in the county are kind of those centralized agencies. Depending on your discipline, where you're requesting PPE from is different. So if you're public health, so if you're a board of health, you're going to be requesting supplies through the Department of Public Health, through their system. And if you're a first response, so if you're police and fire, you're going to be requesting supplies through MEMA, the Massachusetts Emergency Management Agency. So these coordinating centers, command centers, essentially provide a structure to do both so that requests can go in to a centralized organization that's going to know how to guide you and direct your request.
That's great information. Now, how are you working? Are you working strictly from home, or you do go into the office once in a while, or?
So pretty strictly from home. And so our executive director, Tom Matusko, at Berkshire Regional Planning Commission was really proactive in establishing telecommuting policies for us so we could all successfully work from home and providing like, laptops and things like that. But if there is some software on my work computer that I have to go use, we can organize that so that we're the only person in that office space for a designated period of time. But definitely we basically right from the get-go have prioritized employees' health, and there's several of us there that are very essential to this response process, that in order to successfully aid people, we need to be healthy too. And so I appreciate that guidance, but also working from home, we're all adapting. It's an interesting process, I would say.
It is. Now, are you privy to any of the statistics that relate to Berkshire County?
Yeah, for coronavirus.
Can you share any of those with us as of today, which is April 10th?
So they haven't, the Department of Public Health updates their case counts every day at 4 p.m. and then they update their death data every day at 4 p.m. So I won't have anything until DPH releases that on their website, but that is updated daily on the website. But we generally do, so I'm trying to think of how best, I'm trying to just figure out how best what kind of percentages would you be looking for, like percent of the county that has coronavirus, or like, I don't have that number necessarily.
I want to think percentage wise, but I would think case wise.
Yeah,
number
so
of people with that virus, or that have recovered from it, or that have passed away from it.
yeah,
Can you share yesterday's numbers?
So I don't have today's numbers yet. Those aren't released till 4. And I actually don't have the numbers from yesterday in front of me just because it's so rapidly changing. We tend to get, in Berkshire County, we have just over, I believe, 500 deaths from COVID-19. No, sorry. In Massachusetts, there's a little over 500 deaths of COVID-19. I couldn't tell you that for Berkshire County. I think it's around 20 or a little bit above that. And for cases, I think we have just over 300 cases in Berkshire County for coronavirus. But like I said, every single moment and day it's changing. Data can get backed up, and then we've got 3 days of death data being added to numbers from yesterday. And so I would say per capita, we have a pretty high rate compared to the rest of Massachusetts. However, if you look at some graphed data from the Berkshire Medical Center, it looks like our curve is beginning to flatten out here, which is unique in Massachusetts. It's going up exponentially in many of the other counties. And in Berkshire County, while we do have a fairly high per capita infection rate, and infection rates can be deceiving. So in order to test positive, you have to get tested. And so we started a lot of testing, I think, a few days ahead of other counties. We had some really astute physicians at Berkshire Medical Center who, that's how our first case was identified, is that they made a decision that was not a common decision back in, I think, early March or late February to test a patient that they suspected. There weren't a lot of hospitals doing that at the time, and they ended up getting a positive test. So it looked like we were initially a hot spot, but that does not mean because somebody tested positive here that there weren't other people infected in other counties. So I think while the testing's just not widespread enough, I would say, to the general public to draw any conclusions, but I think we're doing okay here. I would say our existing partnerships are really strong, and people in Berkshire County are really taking it upon themselves to hunker down and protect themselves and their family. So we're good at that out here in Western Mass, especially Berkshire County. So I think we're doing a good job.
Well, I agree, Allison, and thank you so much for your time today. But was there a website that you were citing that the public could go to?
Yep, and they can download every day at 4 p.m. They can download the PDF that has all the cases, all the deaths, and they'll have like the age groups and demographic information for each of the cases. I look at it every day, but I never print it out or anything because it's going to be different in 24 hours.
Right, and what is probably the most significant about it is that if you look at it from a moving average point of view over maybe a 4-day period, you tend to get a better view of it, I think.
Yeah, I would say so.
And you brought up an interesting point too, and maybe we could include this in the interview. And that is, we started testing early in Berkshire County, which could have contributed to the fact that at one point in time, we were the 5th hardest hit county in the nation.
Yeah. I mean, I think all eyes were on Berkshire County really when we got those first couple positives in Clarksburg and another community in Berkshire County. Like the smaller towns, everybody's like, okay, if we have a case in these communities, then we definitely have community spread. But the CDC guidelines for who's able to be tested have changed probably in the last 30 days, maybe like 5 or 6 times. And so physicians were not able to test people who didn't fall within these 5 parameters for COVID-19 about a month ago. And so these Berkshire County physicians, I'm not sure who exactly or what exactly their names were, but they were really privy to these really specific symptoms this patient had, particularly the type of pneumonia, and they were able, under the CDC guidelines, to do a test. And that's not to say physicians at Hampden County hospitals weren't doing the same thing or suspicious of possible cases, but I think the fact that these physicians at BMC were willing and able to test so quickly that it looked like we are still per capita, we have a lot of cases, but we ramped up testing. I would say BMC ramped up testing probably faster than a lot of the other communities and counties in the state. So we have more testing sooner, so we had the appearance of a hot spot, but it's hard to tell.
Stay healthy and safe, and keep up the good work.
Thanks, Bruce. You too.
We now turn to Captain Elliot Higgins of the Pittsfield Salvation Army. He and a handful of volunteers are preparing and delivering an impressive number of meals for Berkshire County residents. Captain Higgins, thank you so much for joining us. I understand you are doing phenomenal work in providing meals for people who may not be able to prepare them for themselves or even afford these days to be able to buy food. Can you tell me a little bit about what it is that you're doing now with your organization?
Yeah, well, the Salvation Army in Pittsfield is serving. We're building and serving food boxes, which will feed 4 people for about 3 or 4 days, and it's non-perishable goods. A lot of those goods come from the food bank. We purchase some, and then we have funding from the good people over at the Berkshire Taconic Foundation. Granted us some funding through the Berkshire United Way to help out with that. So I wanted to give a shout out to them as well. And there's been some wonderful donors that have stepped up to the plate during this time. We serve hot meals daily. We continue that using COVID, safety protocols and stuff like that. Serve it out the door. We served since the beginning. So the hot lunch is the hot thing is a brunch, and the dinner on Sunday. So Monday through Friday we have a brunch, dinner on Sunday evening. People will line up at the door and wait for their meal, and we box it up in a take-home box. They can it's hot when they get it, and so hopefully they'll eat it there. But if not, they can microwave it at home. We've served since the start of this 589 meals through that brunch program. We have a regular food pantry, which is still open Wednesday through Friday. This Friday is Good Friday, so it won't be open. But since then, we've served 494 families through that. And we have special emergency disaster food boxes, which I talked about, which we distribute throughout Berkshire County. We distribute to Undermountain School in Sheffield, Richmond School District, Lee High School, Mount Everett in Sheffield, and in Otis. And so there's a big need in the communities that don't have a lot of help, the smaller communities. And so we're delivering food boxes out there to them. So we've delivered so far about 306 of those boxes. Like I say, they feed a family of 4 for a couple of days.
So if you add all of those up, how many meals do you think you've provided since the onset?
Meals would go, I'm going to say, well, the total people served is about close to 3,939. So if you, it's getting upward to about 10,000 people, 10,000 meals served in the community since the COVID crisis began.
10,000 meals since the COVID-19 crisis began. That is awesome. That is awesome. And how are these meals delivered when it's not being done there at the Salvation Army?
Well, the meals, we'll drop them off at the school, and the school will when they come for the school lunches, which is still open, they'll come and pick up the box for their family as well. And so the box will be delivered by the school. We'll deliver it to the school site, and those who are running the school will pass out a box to each family that wants one. And so they're very thankful for that every time we go. And there's not a lot of agencies out there in some of these rural areas, and so they're very thankful for the Salvation Army delivering the food out there.
Oh, I can imagine. So, Captain Higgins, how many people are working on this on behalf of the Salvation Army?
Well, at the Salvation Army in Pittsfield, we have a couple of staff. We have our caseworker and our record keeper, and my wife and I. And then we have the rest of them are volunteers. We have about 5 or 6 volunteers. You're going to have 10 people in the building at one time, so we kind of rotate them in and out. So we have some wonderful volunteers, and one that comes to my mind who's been here every day is our advisory board chairperson, Judy Forrest, and she's well known in the community. Does a lot of stuff, but she's been here every day cooking brunch, serving brunch, helping out with the food boxes. She's been phenomenal. She's just gone above and beyond what you would want your volunteers to do. And we do, all of our volunteers are wonderful, but I just wanted to give a shout out to her. I mean, she's in a professional capacity as far as serving normally on our advisory board, but she's getting her hands dirty and doing the real stuff that needs to be done right now, and we appreciate that.
I was talking with her yesterday, and she told me she has been retired for a while now, and now that she's retired, she's never been so busy.
Yeah, exactly. She never really retired from working. She just retired from her employment. But since she's been going 90 miles an hour every day here, so we're appreciative of that. Hopefully one day she'll have a couple of hours to spend in enjoyment of her retirement.
Let's hope so. Now, if there are some viewers out there that would like to volunteer to help out the Salvation Army, how could they get in contact with you?
Well, the volunteer, we're not really taking volunteers that would be inside now because of the nature of this emergency is widespread. So it's kind of tough to bring in new people because you don't know if they're infected or not. But there are other ways that you can help. You can help by donating non-perishable items to the Salvation Army. You just give us a call, and we'll set up a pickup time or a delivery time. You can donate monetary donations to the Salvation Army of Pittsfield, and in the memo write COVID-19, and we'll be sure to set that aside for this virus situation that's going on right now.
So they would use United States Post Office to mail you a check, for example?
Absolutely.
Is there a way to pay online with a credit card?
Not at this point, but unfortunately, I don't have that set up right here. So, yeah, it could be that, or you could deliver it to the building.
What would be the mailing address they would send a check to?
The mailing address is P.O. Box 871, Pittsfield, Mass. 01202, and of course that would be the Salvation Army Pittsfield Corps.
Wonderful. I am in awe of all that you are doing there with the Salvation Army and approaching 10,000 meals since the crisis began. That is absolutely awesome. Keep up the good work, and you and your staff stay safe and healthy. Thank you so much, Captain Higgins.
Thank you very much. God bless you.
By the time you see this, Captain Higgins and his crew will have delivered several thousand more meals to our neighbors. Thank you for all the hard work and dedication you do. Until next time, stay safe and healthy, and please remember to maintain proper social distancing and wash your hands often. Here is a little ditty to help you with that.
Hi everybody, ready to wash your hands? Here's a little song to get you going. Ready? Here we go. Wash, wash, wash my hands, scrubbing with the soap. Washy, 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 this is how I clean.
Wash, wash, wash my hands, getting on my fingers. Washy, 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 this is good to do.
Wash, wash, wash my hands, getting front and back. Washy, 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 getting under nails.
Wash, wash, wash my hands, getting everywhere. Washy, 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 now I'm really clean.
That was great. Thanks for washing your hands. See you next time. And remember, hand washing is one of the best ways to stay healthy all year long.